Glenohumeral mobilization.
Okay, so we're going to have the patient, we're going to do mobilization of the glenohumeral joint, and the open pack position is going to be abduction at about 55 to 70 degrees, and it's going to be about 30 degrees of elevation, horizontal elevation. So I'm going to lay the patient down in supine. We're going to do the right side. I'm going to make sure that the patient is close to the edge of the table. I want the joint off of the table. I'm also going to place a towel or some kind of support system, whether it be a wedge or whatever is used in the clinic, underneath the scapula to give stability to the scapula. So as I approach the patient, the first technique we're going to do is distraction. So again, the open kinetic or the open chain for the glenohumeral joint is about 55 degrees of abduction with about 30 degrees of horizontal elevation. Okay, so I want to get my cranial hand into the axilla. The glenohumeral joint is positioned where the humerus is on this angle, so I want my distraction force going this way to separate from the fossa. Come into the axilla with this hand, getting close, get my body in position. I'm going to distract and do a distracting force right there. So my force is going in this direction. This is distraction. Okay? Now, also from this position, I can go ahead and do a posterior glide. Posterior glide of glenohumeral joint is going to be very essential for enhancing internal rotation of the shoulder. So I come in, do my distracting force, move my body into position, come over the top, palpate the AC joint, get to the edge of the acromion, and the lateral side of my hand is onto the humerus. As I'm distracting, I do a posterior glide. Take up the slack, do a posterior glide. Okay? Very good. From this position, we can also go in and do an inferior glide. Okay? So I find it easier if you come into this position, and what I'm going to do with an inferior glide, my footwork's important. I want to make sure that my feet, since I'm going in an inferior direction, my feet are lining up in the direction that I'm going to go in. So once again, I'm going to get the patient in his open pack position. My caudal arm and hand is up into his axilla, and my superior or cranial hand is up over the superior side of the humerus. I distract the joint, take the slack out, and from this position, I'm going to do an inferior glide. Take up the slack, and right here is my inferior glide. My forearm and body should be pushing in the same direction as the inferior glide. Okay? Next, we're going to do an anterior glide. Backing up, the inferior glide is good for somebody who's having difficulty with abduction. We're trying to get, it's a convexity on a concavity, so we're trying to improve that. So we're going to back up, we're going to have the patient go into supine in order to do an anterior glide. Okay, so we're going to have him roll over. Again, I want to work my table so that he's around ASIS of the clinician. May even get a little lower. So this time I'm going to take my towel roll or support system and put it right around where the coracoid process is. I'm going to get the patient close to the edge so that the glenohumeral joint and the humerus is off the edge of the table. Once again, I'm in position. I find the open pack position was about 55 to 70 degrees of abduction with a slight bit of horizontal elevation, and my hands come into the axilla. I do a distracting force, and then I get my thigh in there to hold that distracting force, come over with my proximal hand, palpate at the AC joint, find the acromion, and the ulnar side of my hand goes to the lateral side of the acromion. And I will do an anterior glide, being very careful, taking up the slack, and do an anterior translation. Anterior glide. Notice that the elbow is straight, and I'm going in the direction of the forearm. So both hands are going down together. As an anterior glide, that's going to help to enhance external rotation. Okay.